The retrobulbar block is a regional block utilized by both the anesthesiologist and ophthalmologist to provide local anesthesia for patients undergoing intraorbital procedures. It is particularly valuable for surgeries involving the cornea, lens, or anterior chamber of the eye. Obtain and set up all necessary equipment for the retrobulbar block prior to beginning the procedure. Lay out several alcohol wipes and 4x4 cotton gauze squares. You will need local anesthetic for infiltration into the orbital muscle cone. Here we have drawn up a 50-50 mixture of 2% lidocaine and 0.75% marcaine in a 5 milliliter syringe. Use an Atkinson 25-gauge retrobulbar needle with blunt tip for injection. With the patient lying supine, clean the lower eyelid and infraorbital skin with an alcohol wipe. First, check that all appropriate monitors are placed on the patient, then administer sedation. Ask an assistant to elevate the upper eyelid to increase your visualization of the orbit. Palpate gently below the patient's eye to identify the inferolateral border of the orbital rim. The needle will enter the skin at the infraorbital notch, a point at the junction between the medial 2/3 and lateral 1/3 of the inferior orbit. Insert the needle approximately 2 centimeters, keeping it perpendicular to the plane of the face, such that it traverses the path of the orbital floor. Advance the needle until you hear, and possibly feel, a distinct pop. This indicates you have passed through the orbital septum. Redirect the needle medially and superiorly toward the apex of the orbit until a second pop is felt. The second pop occurs as you pass through the sheath surrounding the orbital muscles and into the muscle cone. Carefully aspirate the syringe to ensure that the needle tip is not located in an artery or vein. Slowly inject 2 to 4 milliliters of the anesthetic mixture. Watch the eye carefully. As the anesthetic is injected, the increasing volume under the orbit causes slight proptosis. As you withdraw the needle, inject 1 milliliter of anesthetic to provide anesthesia to the orbicularis oculi muscle. Close the patient's eyelid and cover it with 2 pieces of 4x4 gauze. Gently massage the globe to achieve adequate spread of the local anesthesia. This increases both sensory anesthesia as well as ocular muscle akinesia. After massaging for 1 to 2 minutes, open the eyelid and examine the eye. The sclera should be white. If there is evidence of partial or complete subconjunctival hemorrhage, a retrobulbar hemorrhage may be present. Also, palpate the eye to ensure there is not an increased amount of tension within the globe, as this too may be evidence of hemorrhage behind the eye. If the appearance and tension of the eye are normal, continue to massage the globe for approximately 5 more minutes. This allows sufficient time for the block to take complete effect.